Hi, everyone. Welcome to tonight's KSB Wellness event. We'd like to thank Aaron Fox and KSB Community Wellness for putting this on tonight. I'm Dr. Kyle Swanson alongside Dr. Drew Patel from KSB Foot and Ankle. And we wanted to pick a topic this evening. A lot of times we talk about support for our feet from the bottom up, talk about good supportive shoes, but orthotics is something that we can also add into shoes that can be very helpful in treating different ailments. So we're going to discuss some different topics this evening, including what is an orthotic. We can also call it an insert, so we can use those terms synonymously. Why do we recommend orthotics? There are different types, and then there's a lot of different foot and ankle conditions where orthotics can be helpful. And so we will go through these as well. And we'll brush on a little bit how orthotics are made, and then some advice on proper use. So first, what is an orthotic? Well, it is a device that is placed in the shoe that helps support and correct biomechanical issues. And there's a picture here of 3 different types of orthotics. You can see there's different lengths to them. So they do come in various lengths, and also different materials are used to make them. Each serve a unique and different purpose. And we can prescribe orthotics from pediatric patient all the way to adults. And these inserts can also be over the counter and custom made. And over the counter can be purchased at a store. We'll touch on that a little bit later too. Custom made is specifically for your feet, and we'll go into why that is important as well. They can be worn in a variety of shoes. So any athletic shoe wear, such as tennis shoes, cleats, even dress shoes, and boots or work boots. So why do we recommend orthotics? Well, the main goal is that it helps realign the body from the feet all the way up to the head. And so you can see in the image to the right how on the left side with the red, the body is not in good alignment. There's different angles all the way from the ankles up to the knees, the hips, lower back, shoulders, all the way up to the head. And an orthotic, once placed on the bottom of the feet, can help realign and change that position so it's more like on the image on the right with the green. You can see everything is more evenly aligned and working in a proper position. We do this through pronation control, which is the image down below kind of helps visualize that. So if we're looking from the back side of the heels, the before image, that foot is in a more pronated position. So the ankle has rolled in. And once that occurs, then malalignment from the feet all the way to the head can occur. An orthotic on the right-hand side after this place there can help realign, as you can see. This also provides stability for our feet and ankles. So throughout the day, this will reduce fatigue through our daily routine. And it'll help support various structures such as the bones, the ligaments, the tendons, and the muscles in our feet. So different types of orthotics. Well, there's 3 main types. There's soft, semi-rigid, and rigid. And then there's a couple that I wanted to touch on here that are very important. More so on the softer side would be the accommodative orthotic. And this helps to reduce pressures on the bottom of the feet. Why do we want to do that? Well, there are some conditions where we may develop calluses, which can turn into wounds, which can lead to other conditions requiring further treatment. So if we can reduce the pressure on the bottom of the foot, that will help slow the buildup of callus. This is very important with our diabetic patients and patients that have neuropathy. Neuropathy is decreased sensation in the feet. And so by helping these patients specifically, it can help reduce the chance of a callus. If we get a callus and they may not feel it become painful, then it can advance to the wounds and we have further issues going forward. A functional orthotic, on the other hand, is more to stabilize the foot and ankle, a little bit more rigid. It does help with that pronation control or rolling in of the feet and ankles. It helps reduce body fatigue. And when we do this, it helps reduce injuries as well. So there are a ton of different foot and ankle conditions that we would prescribe an orthotic for. And so we're going to go through a list here. The first one we see is something we see almost on a daily basis, heel pain. there's a variety of conditions that cause heel pain, such as plantar fasciitis, which is that top picture on the left, typically pain on the bottom of the heel, and then Achilles tendonitis, which can be pain on the back of the heel, various other areas of arch pain, metatarsalgia or forefoot pain, as that bottom left picture depicts, and different types of tendonitis as well. The posterior tibial tendon is the main workhorse that helps hold up the arch. And so if this tendon gets stretched or pulled or swelling around it, then it can become inflamed and very uncomfortable. Orthotics help with flat feet all the way from kids through adulthood, and also with pes cavus, which is high arch feet as well. So now I'll turn it over to Dr. Patel.
So the next thing we're going to consider is various different foot and ankle conditions which may be helpful and can be improved upon using custom orthotics or inserts. Few of them include arthritis, shin splints, bunions, and hammer toes. Bunions and hammer toes we often see in the clinic. The goal of using orthotics in conditions treating bunions and hammer toes is like how Dr. Swanson mentioned. We're trying to do preventative care. We're trying to prevent formation of calluses, which can deteriorate to further conditions that may require further treatment down the line. Again, like we said, it helps reduces pressure, which may benefit in preventing ulcerative calluses or ulcers. There's certain patients that have prominent bony conditions that may put excessive pressure on their skins. These orthotics may help offload those areas, which can again prevent calluses and wound formations. They're especially helpful with diabetic patients who may have diminished sensation on the plantar aspect or the bottom of their foot. And having this custom inserts will prevent further complications for them down the line. The orthotics may also be helpful after amputations, as they can have toe fillers as they fill up the excessive or the void in the shoes that patients may have after amputations. So how are orthotics made? There are multiple different ways that orthotics can be made. In clinic, we kind of start off with providing patients with handouts, in which we recommend over-the-counter orthotics and see how they tolerate them, if they like them. And going from there, we may proceed to getting them into custom orthotics, which are customed to their foot. They're made according to shoe sizes. They can be worn in different shoes, like Dr. Swanson mentioned. They could be worn in gym shoes, dress shoes, different shoes. We can also have handouts, and patients may have the option of getting them from Amazon or medical shops near different hospital facilities. For us, it would be Northern Illinois Home Medical Supply. So how are custom orthotics made? There's a very intricate process on how these are made. However, the most important thing is, how do we get an impression of your feet in order to make these custom orthotics? These can be specific to each patient depending on their past medical history, what kind of condition they're going through, and what our purpose is for the orthotics for that patient. We can use a plaster casting mold, which you can see on the bottom. In the middle, we see a foam box mold in which the impression of the foot is technically made just by having the patient press down against the foam. And what we use in clinic more frequently is the electronic scanning, where we just hold the patient's foot in the ideal position and someone goes around and scans the feet, and it kind of just sends a copy to where the custom orthotics are to be made, and we just receive them in the clinic for them to be dispensed. Our advice on use, our basic protocol is, our advice for patients to break into these is that we want them to increase the hour they're using these orthotics over a period of a week or 2 weeks. We kind of say on the first day, use them for 1 hour, the second day, use them for 2 hours, the third day, use them for 3 hours, and so on and so forth until they're wearing them for a full day. Initially, it's advised that patients be mindful that because this is something new to their feet, that soreness can occur and that pain is not normal. So the thing we offer here at KSB is that if you are having difficulties with the custom inserts, you are more than welcome to bring them back, and we can adjust the areas that are causing discomfort and pain to you, and we can modify those areas in order to ensure that they're a better fit, and we can prevent those painful areas for you. In addition to using inserts, we also recommend that you use supportive shoe gear. It is very important that we test the 3-point shoe test in which we're assessing the heel to heel. We want to make sure that the heels of either sides of the shoe do not touch each other. We want to make sure the shoe does not bend anywhere besides the forefoot, and we want to make sure that the heel is rigid. When we put these custom inserts in, we want to be mindful to remove the original inserts, or the shoe can be excessively tight, and that can be the cause of your pain as well. When do we look forward to replacing these inserts? It's either when they're worn or cracked material over time, or when patients have new onsets of pain in different areas of foot that become of concern, is when we want to go back and modify these.
All right, well, great. Thanks, Dr. Patel.
Thank you.
So if anybody has any questions, feel free to leave them in the comment section below. We'd be happy to get back to you. We hope that you found this informative this evening. And once again, we'd like to thank KSB Community Wellness for putting this event on. And we hope everybody has a safe and fun rest of their summer. So we'll see you next time. Thank you.
Thank you.